of Ottawa. Thanks for coming back on.
It's my pleasure.
What do you think of that approach?
Well, I see where he's coming from. In fact, we were advocating for this approach a year ago before we had vaccines. Testing was our best way forward. But we have a better technology now. We have vaccines that are less expensive and far more reliable. So I understand he's erring on the side of civil liberties, and that's admirable to a certain extent, but it's not ideal. The ideal is to combine our best technologies. That means using vaccination and rapid testing.
Right. Now, he's saying, though, this is going to drive a wedge between Canadians, that Canadians have the right to make their own healthcare decisions. To push back, with his approach to this, he's saying we have a reasonable and effective alternative. So if there are Canadians who cannot or do not want to get a shot, let's just do this. Why not do that when we have that availability, or we have that possibility available?
Here's the problem with rapid tests, of which I'm a great fan, by the way. Rapid tests have a high false negative rate, especially if you're symptomatic. So we have to rely on people to accurately and honestly report their symptoms. And if they're symptomatic, then they can't take the rapid test option. And then if you do a rapid test, we have to make sure you do the test correctly. So if it's done at home, there's a high chance again of failure. And then even if everything is done perfectly well, there's a good chance of a false negative, which was why rapid testing is good for regular testing of someone coming into a workplace every day, because if you do it multiple times, you have a lower chance of a false negative. And so for travel, that's not ideal because you get a one-off essentially. For a workplace, I suppose it could work, but then the costs are really quite high. Vaccines cost nothing except for that first jab. The rapid tests are quite expensive over the long term. And then there's what we see in the USA with nurses, for example, given the option of taking a test rather than getting vaccinated. Suddenly they've got time off work to get a test, and it becomes an incentive not to get vaccinated, and it eats up a lot of time. So strictly from an economic perspective, rapid testing is not an ideal way to go when you've got the vaccine option.
I guess, realistically speaking, what I'm wondering is, what's the alternative? You tell people get vaccinated, and you have to in order to come to work, but what if they don't? Then what do you do?
It's a good question. That's a question for the legal scholars and the administrators out there. But
That's what I mean.
yeah, exactly. But it's important to make the distinction, though, that no one is forcing you and tying you down and forcing a needle into your arm. They're saying if you want to do these things in society, then you get vaccinated. And then there's we have to make accommodations for people who can't get vaccinated. There is a tiny proportion of people who are allergic to the vaccine components and so can't get vaccinated. So for them...
And what do we do? What action do we take to keep them safe and to keep the workplaces safe? Do they end up just working from home?
Well, that's an option. Or for them, we do deploy the rapid testing option and with masking and so forth. So university campuses, that's what's being discussed. For those individuals who can't get vaccinated, if you want to come to campus, you got to test rapidly, frequently, do symptom checks, and wear a very high-quality mask at all times. You can't do that for a large number of people, just a handful. It's just logistically too problematic.
What conditions would actually make that a valid medical reason that you wouldn't be able to get the vaccine?
The only thing that comes to mind is an allergy to a vaccine component, and that's vanishingly rare.
Pretty rare to the point where you feel like if that is one reason we could use testing in that circumstance because it doesn't come up that much?
That's right. If you're an adult. If you're under 12, this hasn't been authorized for you yet, but if you're an adult, really, it's such a rare occurrence. I'd be surprised if it's more than a few hundred people in the province. Don't quote me on that. I'm just pulling that number out of thin air, but it's pretty rare.
Okay, we're chatting right now with Raywat Deonandan, epidemiologist and science communicator. Let's zoom out a little bit and look at the province of Ontario. Another 321 cases have been resolved in the past 24 hours in our province. We're reporting 526 new confirmed cases today. The makeup of that is 353 are in people who are unvaccinated, 60 people who are partially vaccinated, no deaths reported. What is your overview? What's your temperature check on the situation right now in Ontario?
Exactly as we predicted, this is a pandemic of the unvaccinated, right? And there is still a large number of unvaccinated people in Ontario who will drive the strain on our healthcare system, especially given that Delta is unlike previous beasts in this pandemic. Delta will rip through the unvaccinated population, as we are seeing. So in some ways, it may be a more serious threat to our healthcare system because of that large number of susceptible people who are now quite likely to become infected. So that's the overview. And I'm glad to see we're having a serious discussion on levers for encouraging further vaccination that will really tamp down the threat to our system.
Are you concerned as we get closer to the end of summer that we might just be hitting a wall here when it comes to the people who actually want to get vaccinated versus the people who are just never going to do it?
Yeah, I am. Now, it's important to think about who are these people. There are those who are the hardcore anti-vaxxers for whom this is a kind of religion, and it's difficult to get through to them for a variety of reasons. There are those who are vaccine hesitant, and they just need to be walked through the data a bit more clearly, and I have all the time in the world for them. There are those who are apathetic, so they have nothing against vaccines. It's just not a priority right now. And there are those who want to get vaccinated but don't have the access at the moment. Maybe they need childcare or time off work. That last group, low-hanging fruit for policymakers. Just, bring the vaccine to your door, pop-up clinics, give paid time off work, etc. For the apathetic, that's where the vaccine passports can really work well. And for the hesitant, that's where the educational tools can be useful. For the hardcore anti-vaxxers, there are actually not that many of them. So we have policy tools. What we need is to deploy them, at scale to bring more people into the fold.
And then finally, I wanted to ask you about the vaccination clinics, because we just heard today the province is working with the public health units and school boards to actually host vaccination clinics in or nearby schools. What do you think of that?
It's a great idea. It's an even better idea to make vaccination mandatory for school workers and people around the schools, but okay, failing to do that. This is important because the number one way to keep the disease out of schools is to keep it out of the community. So if you can increase uptake of the vaccine in the community, you've got a good chance of doing that. I think it's a clever strategy.
All right, Raywat Deonandan, thank you so much for your time.
My pleasure.
Epidemiologist.
The vaccine in the community.